Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As usual, I'd like to tell you and demonstrate the best way to wear your mask. You can see it, or I'm telling you that it's completely covering my nose and mouth, and to wear it any other way would not give you the kind of protection that you absolutely need. Today we continue our conversations surrounding the COVID-19 pandemic. And remember, if you yourself have questions or comments, you may send us a message to 620-6275 on WhatsApp, or send an email to docandcovid@gmail.com. So we continue our conversations today with Mr. Niaz Suban, and we're moving on to the other aspects. Now, what actually happened after you were told that you tested COVID positive? You got a phone call, a healthcare professional, a doctor said to you, Mr. Suban, you tested positive for COVID-19. What actually happened after then? Did they explain to you what the implications were and what was going to happen, etc.?
Other than being told that I'll be picked up within 2 hours to go to an isolation facility, no other information was given. I took the liberty of calling an official to repeat my request of staying home. And it was during that conversation that I was given a little bit more details as to what will happen, what should I walk with, I was even told what to pack and basic stuff, So I guess it was, as you said, those were early days.
Yeah. How do you think you would have felt if you didn't know an official to call and get that kind of explanation?
I was tormented mentally because of what I told you, what I was worried about. I think I wanted a little bit more reassurance than anything else. And I think the fact that the official that I called was aware of my underlying condition that I would have sought treatment for 2 or 3 days before. I was a bit surprised in that. So I got the way the system worked, that somehow the information was with that person. And I think she stressed that because of that underlying condition, she don't think it will be right for me to be at home. She would prefer for me to be in an institution where, if anything were to happen, God forbid, that I could be responded to quickly and get the kind of treatment that I may require at that time. Of course, at that moment, I didn't want to hear that, but subsequently I realized that it might have been maybe the best decision. It was
good
made.
advice.
Yeah.
And I think so too, with all that we know about the COVID-19 and all of the risk factors and things that lead to adverse outcomes in patients as well. So it was good advice that you were sent to an institution. Now, how was your experience in that institution? So I assume after you were told, you waited your 2 hours, they came and they collected you and they took you somewhere. What happened there?
Well, they took me to Diamond, and of course the reality started to creep in. And there weren't much people. I gathered there might have been 4 of us. I couldn't see. I saw one person, and where I was, there was another person. And 2 days after, the person died. One of those persons died.
At Diamond Hospital?
At Diamond. And he was right next to me. His room was right next to mine. I think the separation from the doors was just about a foot or 2 feet. So I had to pass his door to go to the washroom. And when he died, I figured I was the only person left on that level of the building. And I was scared. I really was scared, and I felt that I was about to lose control of myself and whatever, because I'm not a person who's accustomed being alone in a big home or whatever. I'm not accustomed to that. And while parts of my life I was forced to do that, but you got accustomed to certain things, and being there now when somebody died, and then you know you're positive, you don't know what will be your outcome. There's a lot of uncertainty that was going through my mind, and there was no one to talk to other than family. At that time, the doctors at Diamond, they were not housed in the same building. They were in another building, so communication was a bit of a challenge, except through cell phones. So even if you want to talk to someone to comfort you, it was a bit challenging, not impossible, but challenging. And about an hour or so after, I got a call that I'll be transferred to the Georgetown Public Hospital Corporation. Now at that moment, I wasn't told ICU or whatever, just told GPHC. And I got more worried, Doc, because to the understanding I had, that the GPHC was for more critical cases. So I'm wondering, what is wrong with me? Are the doctors aware of something that I am not? Why are you taking me to Georgetown Public Hospital Corporation? And the doctors at Diamond could not provide an answer, right? And that really worried me. So the journey from Diamond to Georgetown was a very scary one, an extremely, extremely scary one, because I wasn't sure why was I going there. And then when I got there, I was not even aware that I was in the ICU. I know ICU being something else,
right?
Another part in the hospital. So for me, this was like a COVID ward. In reality, it was. But then subsequently, when I saw reports coming out that I was in the ICU, I started doubting myself. And I said, no, I'm not in the ICU. I figure ICU is a place where you're hooked up to all kinds of machines, life-saving machines and all those kinds of stuff. And I was on some machines to do tests, yes, but not like that.
Right.
Eventually, I learned that it was actually named the intensive COVID care unit.
ICU. Right.
Yeah.
Did you receive any kind of treatment or testing that were done for you at the Diamond Hospital?
No.
No. So you were just there.
Yeah.
You were fed, and you were kept in an isolation or quarantine area.
Yeah.
But no specific treatment was given, and no particular testing was done for you. Okay.
Not at all.
How is that different from what happened at Georgetown Hospital for you?
Vastly different, Doc. When I got to Georgetown Hospital after my initial apprehension and so on, and I saw the kind of machines that were hooked up to me, they were prepared for me. And again, I was a bit shocked, pleasantly shocked. So they had the ECG machines and all the things ready. So when I got on the bed, they hooked them up very quickly, checked the heart, because the underlying condition was the heart. And they were checking me. So I was kind of surprised that they knew all of that. Everything was in place. So then I didn't have to go in the bed, then ask questions. By the time I got in, they hooked up, did all they could have done. And when I saw the treatment that was meted out to me and others, I was pleasantly surprised. I didn't realize that they had that high level of care. And what was very, very important, Doc, and I always like to make this point if you'd allow me, is not just the medical treatment that you got in terms of medicine and whatever, but I felt the attitude of the healthcare workers was very important in a way that it was inspiring. It wasn't. We all have, or many of us have, a negative perception of Georgetown Public Hospital Corporation. And I say that not in a way to be disrespectful to anyone, but that's the kind of perception we have. But in that room, in that ward, these were professional people. These were people who took time to work with you, to listen to you, to care for you, not just come to give you medication and injection and go away. And I thought that was really, really different. And sometimes I ask myself if I was really in Guyana. You know, and I really want to commend those people, because that professionalism wasn't just because of if they had known who I was, but it was for every patient.
Good.
I saw that for every patient.
Well, I'm very happy to hear you say that. I myself have been a member of staff and affiliated with Georgetown Hospital since 1998, so 22 years now I've been a member of staff at the hospital, notwithstanding the years of studying overseas. I believe it was about 12 years. And I keep saying to people that when you are sick and you're critically ill, the best place in this country so far is the Georgetown Public Hospital Corporation. Regardless of all the negative impressions in press, there is a group at Georgetown Hospital completely committed and dedicated to helping people, helping their fellow Guyanese. And that has been true since I started there and continues to be true. And people are continuing to receive high-level care at Georgetown Hospital. It's growing, it's expanding, it's improving, and it's continuing to be the leading source of advanced health care in this country.
I saw it firsthand, though.
So I'm glad you said those very kind words about the staff that is there right now. While there, did you receive any new or novel treatment that you would want to mention?
Oh yes, I spent a total of 49 days, and there was a time when every time they did a test to retest, because you had to get 2 negatives within 24 hours, I think, before you could have been cleared. And every time a test was done, it was coming back positive, to the point where I think the doctors themselves felt so saddened to come and give me bad news. So one actually told me that and actually broke down in some way, that she was really saddened to tell me that. And I remember one time I got a negative test and I felt good, but then the next one came back positive, so I felt bad again. So it kept going like that until one day a doctor approached me and said they're considering to give me the convalescent plasma, I think. Convalescent plasma, sorry. And that scared me. And I'll tell you why it scared me, because again, I'm thinking this is only for people who are critical. And I keep asking myself, is there something that they know that they're not telling me? Something that they're seeing from my results of all the other tests they're doing that they're not telling me. And I know from my little science thing that you had to have compatibility and all these kinds of stuff. And because, again, of the perception of the hospital, I was worried about whether this was screened well and all those. So all those things percolated in my mind.
Right.
And they told me to take some time, think about it, and I have to sign a form. Now, that petrified me. Why do I have to sign this form? Am I signing off on something? And I felt bad. I didn't even tell my family, I called a friend who has a child doing medicine in the US just to get some advice, and the person said that's the best thing can happen to you. Fake it, it's going to be good for you, and whatever. And then I signed, and they gave it to me, and I can tell you, Doc, every part of that process to give me that, I did not look at it. I turned my face away. I did not want to see anything that was going on. I was so scared.
So you didn't even see the color of the bag?
I saw the color of the bag when they came in with it. It was kind of a pale yellow or something like that. But after that, from the time they started hooking me up, I turned my face. And for me, I think it took like about 28 minutes thereabout. It was the longest 28 minutes of my life in recent time. And I remember afterwards when I called my wife to say, look, this happened. She was also worried. Why didn't you call me? Let us know. But I guess things happen at the moment, But that helped, because I think I got it a Wednesday, and the Sunday I was discharged. So I'm really, really thankful whoever made the decision to do that, because I know there was a team on the outside that was monitoring all the results that were for all the patients, and guiding the team on the inside. So I know there were experts. I think you might have been in that team as well, and I'm getting emotional talking about it. And the fact that they were able to look at my case and that of others and say, look, that I need to have that to help me out. I'm so grateful to you and to all the others.
Did you get 1 unit of the convalescent plasma or 2?
1.
1, okay. Yeah, well, the credit for that is spread around the entire hospital and the healthcare facility and the fraternity itself. There were many persons who are involved from the time a sample is taken from a donor to the processing in the blood bank, the lab technicians, the lab director, for them to then match that against the actual recipient or the patient. That's a whole process that involves, lots of skilled, highly dedicated and committed individuals just to ensure that this patient who is in need for this thing gets it in the best possible time and place, that it makes the best outcome and provide positive improvements in these patients. So I'm glad that you mentioned that. I'm sure that the members of staff who may be watching or listening to this program, they would feel comforted in knowing that they actually made a difference to a patient who needed their help. So you were there for a long time. I believe so far you are the longest COVID-19 staying patient in a hospital facility in Guyana.
In the ICU, yes.
Yeah, and that must have been some experience, and for almost 50 days, almost 2 months. What happened to your personal life during that time?
I had to learn to compartmentalize emotionally, because I would have suffered from depression 4 years, but over the last 4.5 years, and towards the end of 2019 I was feeling better. I felt I was coming out of it. So in the COVID unit and all the shock that it brought to me, and I remember the doctors them saying that, you know, whether you suffer from depression or not, being in a facility like that can result in some level of, you know, depression and that kind of stuff. So I had to try very hard to just try to think about being in the hospital and trying to get better, so as to prevent myself from slipping back to what I would have experienced over the last 4.5 years. My family was very crucial to all of this. So whatever was happening at home, however they were making out, whatever challenges they were facing, they would have hid it from me, you know, not tell me, and they just wanted me to get better. And there was I couldn't focus on everything else, but what I was really worried about, I knew being in that room was getting to me. I knew it was getting to me. I felt, because I knew what I went through with the depression, and I knew there were signs that were already showing up. But thankfully, I think because of the help that I got, therapy for the depression, one, I was happy that I was able to spot it. I was able to tell the doctors about it. They were not surprised, because they know what the situation that can do to patient. And immediately they got into contact with the hospital. I don't know, you call them psychotherapists, psychologists.
The psychology department,
right.
Yes.
And they worked with me over the phone, 2 of them. They worked with me every day over the phone, and that helped. It really, really helped. But it can be a place where your sanity is really challenged or tested, you know, to a great extent.
Hopefully you would have learned something, and it would help you in your fight if you should become infected, or it would help you to prevent infection or understand more about those around you who may or may not have had the infection or come in contact with those with infection. So thank you once again for joining us, and please remember, if you have questions or comments, you can send WhatsApp messages to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining us.